Total Cardiology always keeps the patient at the center of our attention.
I found the staff at Total Cardiology very knowledgeable, enthusiastic, very professional, and totally interested in my well-being.
We have technology that is up to date and very much focused on patient-friendly approaches to understanding their conditions.
Total Cardiology, with 21 outpatient, hospital and university-affiliated cardiologists, is the largest community-based cardiology group in Canada. We have more than 100 highly trained technologists and staff. In addition to nuclear cardiology testing, Total Cardiology offers a broad scope of services, including rapid access clinical consultations, cardiodiagnostic testing, and cardiac wellness and rehabilitation. Our goal is to provide you and your physician with rapid access to a high level of expertise and an excellent patient experience in a stress-free environment.
We now have the opportunity to introduce varied therapies, be they medications or procedures, and they all translate into far better outcomes than before. So having a label of heart disease doesn't engender a doomsday scenario for all people at this time. We have many opportunities open to us that we never had beforehand.
In order for us to give you our best, there are some things you can do prior to your appointment. Write down your symptoms and any questions you may have for the doctor. Bring a list of your medications, over-the-counter drugs, and any vitamins or herbal treatments you are currently taking. Also, remember to bring your health card. At Total Cardiology, we are focused on your patient experience. It is our goal to see patients promptly, so plan to arrive 15 minutes early. The entire series of tests will take approximately 6 hours. If you haven't filled in the pre-registration form online, there may be a small amount of paperwork to be filled in. The testing may require you to wear a gown, so please wear a shirt or blouse that is easily removed.
Can I ask you what time you ate last night?
24 hours prior to arriving at Total Cardiology, you will be asked not to have any caffeinated products. This includes coffee, tea, chocolate, and cola. You may, however, drink water up to 2 hours before your appointment. Also, do not eat the morning of your test. You may also be asked to stop taking certain cardiac medications 24 to 48 hours prior to your test. Please review your pamphlet 48 hours prior to appointment. At Total Cardiology, we understand that one of the keys to reducing the anxiety of the day is to make sure you understand how the testing will be done.
We'll bring you over to the treadmill. We'll have you work as hard as you can.
Nuclear imaging requires that you receive a small dose of thallium. Thallium is a weak radioactive substance that allows your nuclear cardiologist to view images of your heart.
The next thing I have to do is start an intravenous, and that's how we give you the thallium. And could I take you
in the
right
change room, an IV will be set up in your arm so that the thallium can be injected just prior to the end of your upcoming treadmill test. It is important for us to test your heart at its maximum yet safe working capacity, so the first part of the test that will be done is to stress your heart by using a treadmill. For those who can't achieve a sufficient heart rate, you may receive medication. This will be at the discretion of the supervising physician, who will discuss their decision with you.
I'm going to get a baseline blood pressure before we start.
Okay.
And then I check it every 2 minutes that you're on the treadmill.
Okay.
You will be asked to walk on a treadmill at an ever-increasing intensity while we monitor your ECG, blood pressure, and heart rate.
So every 3 minutes it gets a little faster and steeper.
Okay.
Let me know if you get any chest discomfort or you don't feel good.
Okay.
When you have just about reached your maximum exercise capacity, thallium will be injected into your IV.
How you doing, Dennis?
No, not too bad. I'm getting a little tired now, though.
All right. Are you at the point you think you can do 1 more minute?
Yeah, I think so.
Okay. So we're ready for an injection on treadmill 1.
Once the treadmill test is done, you will go to the nuclear camera. Our scanners represent the very latest technology in nuclear imaging. And Total Cardiology is the first in Canada to routinely employ the use of a CZT camera in combination with a standalone CT scanner for cardiac imaging. The main benefits of this technology include better images for diagnosis, faster imaging times, and less radiation exposure. Additionally, the time it takes to obtain the images is reduced in half.
Okay, so I'm starting the pictures now. It takes about 8 minutes for the pictures.
It affords the opportunity to give a lower dose of radiation to the patient and shorter imaging time, so it's far more patient-friendly, and we think, of course, it's safer in the long run.
Following your stress MPI, you will have a CT scan done. This test takes about 2 minutes.
Breathe in, breathe out.
Once the CT test is done, you are free to leave and will be given a time to return for your second rest MPI scan in about 3 to 4 hours. You will be able to resume certain types of medication during this break, but you will be asked to continue fasting. However, during this time, you can have certain fluids such as black coffee, black tea, diet pop, or water. While you are away, the images are sent to the processing computer. When you return, you will have one more heart scan. This time, we want to check your heart in a resting state. Once this second MPI scan is done, it is processed with your previous tests and immediately sent to the nuclear cardiologist for interpretation.
The results are stellar. Total Cardiology is able to generate reports within 24 hours of the study being conducted and generate a very sensitive, accurate report that's improved upon from all the prior technologies that we've had beforehand. In fact, patients that were being tested today will have reports sent out today and in the hands of their physicians.
You get results, and you're going to get a plan to fix it.
Very good.
Total Cardiology is the one group of people you want in your corner in terms of going forward with your life if you've got cardiac issues. We just look forward to the future with a lot of confidence. My family is part of this team because they've been very helpful to my family in terms of understanding what's been going on with me. I don't come here with any stress. I come here knowing we're going to get something done here and it's going to make my life better.